Today, our healthcare system has evolved to the point where you have lots of specialists that see patients, especially the patients that are most in need, and that results in a lot of little silos of data. It's tough to keep track of, in a holistic way, what's actually going on with you as a unique individual.
Like so many people, I've spent decades now frustrated at the slowness of progress in healthcare. We've all seen the promise of personalized medicine.
There are an awful lot of factors that prevent patients from getting personalized care. We live in a one-size-fits-all medical system.
One-size-fits-all is a very bad thing for medicine. Even for your regular, everyday consumer, everything now is personalized. When you're buying a car, when you're choosing anything, it becomes personalized to your needs.
I think one of the ways we can achieve more personalized care is through the concept of precision medicine. Let's get the specific laboratory tests, let's get the genetic makeup, let's have the analytics.
So we get out of the idea of it's only genomics and it's only a medication into it's a full patient story where I am looking at you as a person.
It's essential, of course, to getting healthcare costs under control, and this is a major societal problem that we all face. It threatens our economy as well as our individual and collective health.
So I think what we need to move from is standardized care, population care, into a standardized, personalized care. Unfortunately, it's buried in the big data that we have, and at the end of the day, we cannot tell what's the best outcome, who took which treatment and had the better outcome.
So at HC1, we're really passionate about replacing trial and error healthcare with this precise approach to health that gets everybody diagnosed in an optimal way. And we're doing that through our Precision Health Insight Network that already connects to over 22,000 different diagnostic locations, where we're able to collect and analyze in a secure manner all this information and identify those risk signals that otherwise go unnoticed until it's too late.
I think we need, again, to step back from generalizing the treatments into personalizing them into your specific case.
So I'm confident that precision medicine will allow us to reduce waste, reduce harm, and improve outcomes.
So that you can move on knowing with confidence, and your clinicians can know with confidence that you're getting the access to the best possible care for you and your family.